Hello InstaFam, it is Dr. T here, coming to you on a dark and stormy night. Dark and stormy used to be something else when I was young, but it is a really dark and stormy night here in Perth. It is Thursday. Normally I come to you on a Wednesday night, but I was struck by a conversation that I had with a patient today who will remain nameless. And it got me really thinking about the impact that the infertility journey has on our mental health. And I wanted to just share some thoughts with you tonight. Of course, if you have questions that you have around the fertility space, particularly the mental health and fertility space, please don't hesitate to drop them into the comments section. Don't tell me your life story. I'm very happy to answer everything, but it will be short and sweet and as to the point as I possibly can. Now, yes, from this conversation that I had today, it really got me thinking about mental health and the infertility journey and just how traumatizing this infertility journey can be. And I've got to tell you, there are a lot of parallels between this journey and the cancer journey. And as you all know, I know that space pretty well. So things have certainly resonated with me when I've had conversations with patients around their fertility journey experience. The ANZAR database is a database to which all fertility centres in Australia contribute their data. So the good fertility centres and the bad fertility centres. And we contribute our data on an annual basis. So we present our IVF rates, our clinical pregnancy rates, our live birth rates, our OHSS rates, frozen embryo transfer rates, donor rates, and so on and so on. And something that the ANZAR database has started to do is collect data on the longitudinal journey of a woman. So instead of just going to each fertility centre and saying, hey, give us your data, they're actually following women who might move from centre to centre throughout their fertility journey. And they're collecting data on that woman's journey. And a couple of years ago, for the first time, they presented some data around couples who pull out of treatment after getting a negative pregnancy test. And what the data showed us is over a 10-year period of time, with each negative pregnancy test that a couple got, or a woman rather, it was woman-centric data, with each cycle that a woman didn't get a positive pregnancy test, 25% or 1 in 4 of them will drop out of fertility treatment. And the main reason given was the psychosocial burden. Not the injections, not the hormonal impact, not the surgery, but the psychosocial impact of the fertility journey. And what I see on a day-by-day basis is women who use overwhelmed, traumatic, painful, emotional, roller coaster terminology when they are referring to their fertility journey. And it's kind of like we're torturing women. So I can't express more how important it is to ensure that you have psychosocial support during your fertility journey. So many times I find that women particularly will minimize their mental health. I'm fine, no, I'm doing fine. And then we all see those amazing fertility stories on Instagram, how people are injecting themselves and they're getting through and, you know, they're celebrating at the end. But we very rarely see all the really, really dark times. And so I want to say to everybody watching this out there that never is it more important than to arm yourself with support during this journey, because it will challenge so many things. It challenges your relationships. So I was gobsmacked, actually. I was doing a bit of a search online as to the research looking at relationship breakups as a result of the infertility journey. And I was sure I would find data suggesting that, yeah, divorce rates or separation rates are higher. But funnily enough, there was a paper that was published. It's a demographic research paper, so looking at demography of a US population from 2002 to 2013. And they actually showed that in those people who were exploring fertility treatment, whether they got a successful outcome or not, they were far less likely to divorce than those who did not have fertility treatment. And that included the people who had success, but also the people who did not have success with their fertility journey. And so the summary of this article was that, hey, this is a process that can really solidify relationships. It can bring relationships together. And I have no doubt that this certainly helps to raise difficult conversations amongst couples, and certainly helps to lay certain values and desires and dreams on the table for people to talk about. So yeah, absolutely, it can really solidify a relationship. But I do believe that equally it has the opportunity to destroy relationships. And part of that reason is that we all know it is our biological right to have a family, but it's our biological right to have children, but some people find it biologically difficult. And so it sometimes really challenges that, well, who am I? My identity, how do I define myself? Whether you are defining yourself as a father or a mother or a parent, it is certainly something to really challenge who you are and how you define yourself. So that can be hard for people because it will bring up emotions, big feelings, and many of us have learned how to put our big feelings aside, especially those women out here, and put your hand up or your thumbs up if you're one of those people that, when someone says to you, how are you going? I'm fine, I'm doing just fine, even if perhaps life isn't just fine right now. The other thing that I think that it can really challenge is it can challenge that relationship you have with yourself. Many people have told me in the past that they feel like their body is broken. And when we take them through that fertility journey, there are so many things that make them feel like they're broken and exposed and vulnerable. Transvaginal ultrasounds, blood tests, discussing poor outcomes, difficult results, all of those things can really take us to our most vulnerable, most exposed place. I certainly know that during my cancer journey, there were so many times that I felt vulnerable, that I felt alone, that I felt powerless. And I do think that this fertility journey can really take you to those places. And if you're not well prepared with the coping strategies to deal with that, it can be a very mentally challenging space. So I think that every single person who commences on that fertility journey, no matter whether it is doing OI or doing IVF or doing donor treatment, no matter what it is, I honestly believe that everybody should embrace seeing a psychologist or seeing a counsellor as part of your journey. It was something that was told to me as part of my cancer journey. Tamara, it's a good idea to have some sessions with a psychologist. And there was that moment where I went, no, I'm fine. I can get through this. I understand this. I'm a doctor. I get the biology of this. I understand chemo. I know treatment. I'm fine. But there was also part of me that just said, go with it, Tamara. There are aspects to this journey that you won't understand and you won't be able to make sense of. And I truly believe that in the fertility journey, that's the same thing. No matter whether you understand an IVF program, no matter whether you think you have a really good handle on your health, and or the pathology you might have, whether it's PCOS or endometriosis or male factor, no matter whether you understand it, there will be moments in this journey that you won't understand. There will be emotions in this journey, big feelings in this journey that will really challenge you. And to have somebody in your corner who's objective, who can listen to you in the vulnerable moments and can help you discover the coping strategies and the strengths within you to deal with this really challenging journey is, I think, an essential part of treatment. So I guess my big aha moment for everybody out there who is about to commence, who is in the progress of, or even coming out the end of fertility treatment, don't undervalue the importance of connecting with the psychologists and the counsellors who are attached to your teams or your clinics. They're a hugely valuable resource to you, and perhaps it's just a moment to humour me because perhaps you just don't know what you don't know. But to be able to tap into somebody who can help you navigate this potentially traumatic journey is a really, really important tool for you to have in your armoury. So there's my little tips for tonight. I don't think anybody... Oh, Karen, you've dropped something in there that is accurate. It's a journey like no other. Many people say they wouldn't wish it on their worst enemy. But no questions. I have everybody gobsmacked or struck. Have a beautiful rest of your week. Look after yourselves. Fill your cup. Make sure you care for and show compassion to those around you, and I'll see you next week. Bye-bye.